Good morning, committee. Thank you for being here. Staff, thank you also for being here. And conferees, thank you for being here. We appreciate you taking time out of your busy schedules to come before us. So with that, we're going to get things going. I need a motion to approve February 2nd, 3rd, 4th, 5th, 9th, 10th, 11th, 12th, 13th, and 16th minute dates. A motion by Representative Berquist, second by Blex. Representative Blex. All in favor say aye. Aye. Opposed, same sign. Minutes are approved. Okay. Let's get moving here. Who's going to do 328? Carly's up for 328 to explain it to us. Thank you, Carly.
Thank you, Mr. Chair. Good morning, or good afternoon, committee. Senate Bill 328, as introduced, permits a pharmacist to distribute epinephrine delivery systems to schools for emergency medicine kits and amends definitions related to medication in schools to allow for the use of epinephrine delivery systems. Section 1 amends KSA 65-1680 to expand the types of pediatric dose epinephrine that a pharmacist is allowed to distribute to a school for an emergency medications kit, from solely auto-injectors to epinephrine delivery systems. Section 2 amends KSA 72-6282, the statute authorizing self-administration of certain medications by students to allow for epinephrine delivery systems. Section 3 amends KSA 72-6283, the statute allowing a school to maintain a stock supply of emergency medication to expand the term epinephrine auto-injector to epinephrine delivery system, which means a device that is approved by the FDA, which contains a pre-measured dose of epinephrine and is used to administer epinephrine into the human body. Corresponding amendments are made throughout the bill to update the term auto-injectors to delivery systems. Senate Bill 328, as introduced, passed the Senate 40-0 and would take effect on July 1st, 2026 upon publication in the statute book.
Very good. Thank you for that, Carly. Committee questions? Man, you did a great job. Okay, first item of business, we have proponents, Kimberly Martin, Legislative Chair, Kansas School Nurses Association. Kimberly, welcome to committee.
The Kansas School Nurses Organization in strong support of SB 328. Current Kansas law uses the restrictive term epinephrine autoinjector, which means that by law, our schools are tethered to needle-based devices. SB 328 proposes a simple but vital change, replacing that term with epinephrine delivery system. This matters for 4 reasons. For medical modernization, science is outpacing our statutes. The FDA has already approved needle-free options as a nasal spray called Neffy. And we have heard that a sublingual form, which would go under the tongue, is coming down the pike. So we want this bill to be able to handle any new forms of FDA-approved epinephrine delivery so that we would be able to stock whatever form we need in the schools. It also removes a barrier that teachers and coaches who we sometimes delegate to be able to give these are afraid of needles and don't like to give needles to children. So if they could do a nasal spray or in the future a sublingual form, it would be much better for them and they would be more willing to do that. It also, there's skyrocketing prices and shortages of EpiPens often. So by broadening the definition, we invite competition, which allows school districts to purchase whichever FDA-approved product is most available and affordable. It is possible that the nasal spray form is going to be much cheaper, and there are programs for schools. There's a program called Neffy for Schools, where schools will be able to get reduced cost epinephrine. And then for the rural districts, medications often sit on buses during Kansas heat waves or freezes, like on the way to athletic competitions or field trips, things like that. And so the newer delivery systems are more stable in extreme temperatures. So as a conclusion, Kansas wouldn't be alone in this. States like Missouri, Ohio, and Texas are already making that shift. SB 328 costs the state nothing, but it gives our schools the flexibility they need to save a child's life. And I'll stand for questions at the appropriate time.
Very good. Thank you for that, which would be right now. Committee questions? Very good.
Thank you.
Thank you. Okay, next we have Kimberly. Kimberly, I'm not going to try your last name. You could pronounce that for me.
Okay, thank you. I appreciate you letting me come and talk with you this afternoon. Thank you, Chair Carpenter and members of the committee. My name is Kimber Kazitz. Full name is Kimberly, but I am the Director of Health Services, Homebound, and 504 Services for the largest school district in Kansas, Wichita Public Schools. I also serve on the Kansas School Nurses Organization Board as well, along with Kimberly Martin, and I am in strong favor of this bill, Senate Bill 328, not just for my school district, but for the whole state of Kansas. We have students in rural areas in Kansas that the EMS systems cannot get to quick enough. If there is a life-saving situation where we have an emergency and someone has an anaphylactic response and a severe anaphylactic response to foods, a medication, something like that, or even a bee sting. I personally use an EpiPen for anaphylaxis to bee stings. So this is near and dear to my heart. I want to make sure that we have options to offer our school districts, not just Wichita Public Schools, but all school districts, safe ways to administer this and save lives of our students. You may not know that a lot of our children in schools, the first time they ever have an allergic reaction is at school. We try to offer these fresh fruit and vegetables to kids through grants and things, and sometimes we see kids will try a fruit they've never tried before and didn't know that they had an allergy. This is really important. Our goal is to keep kids healthy and safe at school. I've also used this for staff that have had severe anaphylactic reactions at school as well. And as we know, not everybody's a nurse in the school. Many schools don't even have a full-time school nurse in them. The ones that do, they're lucky. But so we delegate under the Kansas State Board of Nursing, the Nurse Practice Act, we can delegate to people that are not licensed as a nurse. It's very scary, like Nurse Kimberly shared. If you're not a nurse, thinking about using an auto-injector, even though they're very safe and easy to use, if you're not a nurse, they're scared that they're gonna harm a child. And I always say, you're not gonna harm a child, but you might save their life right then. If we have these other modalities that we can use, the nasal spray or when sublingual is available to us, it's going to make it much easier for someone that is not clinically prepared like an RN or an LPN. So I would really appreciate your thought on this in keeping kids and our staff safe when there may be an allergic reaction and anaphylactic response. Thank you so much.
Very good. Thank you for that. Committee questions? Wow. Oh, Representative Howell.
Thank you, Chair. This is not exactly a question for the conferee, but just I think right in front of you, Chair, there is actually a Neffy nasal spray that actually is mine. I just got those for the first time instead of having an EpiPen, and I just thought maybe the committee would like to look at them. So if you just want to pass it down and everyone can look at it, but I do need them back, y'all.
Yes.
Very good. Thank you. Thank you
Yes,
for that.
thank
My
you.
wife carries an EpiPen. She has a severe allergy to iodine. So shellfish and that kind of stuff just, yeah, so I get the whole thing. I'm really, committee, are there any other questions? I'm just surprised that it's taken this long. I mean, you know, I just can't hardly, are you kidding me that we're not doing this? We haven't been doing this for years. I mean, and it truly is life-saving and life-threatening deals
It
come
is.
from these allergies. So I'm just surprised that it's taken this long, I guess.
I
don't know where I've
agree.
been. So anyway, committee, further questions? Thank you so much for being here.
Can I share one thing with you?
You may.
In our district, in the last 3 years, we have administered 29 doses of stock epinephrine to save lives. I don't know what's happened in other districts, but in Wichita Public Schools, that's what's happened. I thought that might be impactful for you to know.
Very good.
Thank you.
Thank you for that. Okay, committee, I'll bring your attention to the proponent testimony from Heather Braun and Kenneth Mendez. And we will close the hearing on Senate Bill 328, and we will open the hearing on Senate Bill 448. Danica, thank you.
Thank you, Chair. Donica Short, Office of Revisor of Statutes. Senate Bill 448 creates a new section of law that would permit the use of expedited partner therapy. Subsection A provides defined terms, including expedited partner therapy, healthcare provider, and sexually transmitted disease. Subsection B provides that a healthcare provider who clinically diagnoses a patient with a sexually transmitted disease may provide expedited partner therapy if, in that provider's professional judgment, the patient's sexual partner is unlikely or unable to present for examination, testing, and treatment. It further requires that a provider who provides expedited partner therapy to provide counseling to the patient, including distributing written materials to the patient and the patient's partner. Subsection C provides that no provider or pharmacist shall be liable for civil damages resulting from any act or omission in good faith compliance with this section, or subject to disciplinary action by the State Board of Healing Arts or other applicable board on the basis of an act or omission in good faith compliance with this section. Subsection D provides that the written materials that the Department of Health and Environment must provide include a warning that a woman who is pregnant or might be pregnant should not take certain antibiotics, information about warnings of allergies for the sexual partner, and the requirement of sexual abstinence until a period of time after treatment to prevent infecting other sexual partners. The Senate committee made no amendments to the bill, and SB 448 passed the Senate on a vote of 40-0. It would take effect July 1, 2026, after publication in the statute book.
Very good. Thank you for that. Committee, are there questions for Danica? Representative Ellis.
Thank you, Mr. Chairman. You stated partners, plural?
Take a look.
And if so, how many?
So in B1, it says, let's see, B1, page 1, line 28 says partners. So if I said partners, I misspoke. Unless it says partners elsewhere throughout. But B1, which may provide that expedited partner therapy, it says partner.
Partner, okay. Thank you.
Representative McDonald.
I guess to follow up, does that exclude giving it to more than one person if they've had more than one partner? In your legal opinion, do you think it would need an amendment to say partner and/or partners?
I may defer to Jenna. I don't think.
Thank you, Mr. Chair. I'm trying to find the statute, but we have a rules of construction for statutes, and typically the singular can apply to the plural. So that would not prohibit it from being done to more than one partner, but that would be up to the judgment of the physician.
Thank you.
Representative Meyer, sorry.
You got it. Thank you, Mr. Chair. So looking at this, I just had a question, if you could tell me the requirement of sexual abstinence until a period of time. 4, that is just information on the requirement. There's not any real way to require the requirement. Is
That's
that
correct. That's under subsection D, so it's part of what the department shall provide in their written materials. So
Okay.
it's more of like, yeah, what they should include in the written materials.
Okay,
More of a
thank
guideline rather than something that they could enforce.
Sure. Thank you.
Committee, further questions? Seeing none, thank you, Danica. Okay, we have a proponent, no stranger to this committee, Senator Bill Clifford. Welcome to committee.
Thank you, Mr. Chairman, and Vice Chair Brown Bryce and Ranking Ruiz. It's good to be among friends, although last time I was at this podium, you kept me here for 30 minutes, so I'm missing a committee meeting, so I may not be here that long. Yeah, thanks for considering this bill. It's been languishing in either chamber for probably a decade. And embarrassingly, we and South Dakota are the only states who don't have partner therapy. You might hear that from other conferees. I'm an ophthalmologist. I'm in active practice. Actually, I see patients tomorrow in Colby if we get off the Senate floor. We see about 10,000 patients from 6 states. We see sexually transmitted disease in the eye nearly weekly. We get a lot of red eyes, and we always have to distinguish, is it chlamydia trachomatis, or is it some other origin of the chlamydia? So this is a real thing in teenagers and young adults particularly. So this would give us a tool to legally treat these patients. Hopefully the bill will get through before the State Board of Healing Arts hears my testimony. We do this now. Healthcare providers, physicians, we take care of the patient in front of us. We know they're going to come back with a recurrence, even if they get cured, because their partner needs to take essentially simultaneous treatment. That's why the word expedited is here. I will only vouch for the eye. I could tell you a lot or give you my limited knowledge about OB, but I think this is pro-women. It's pro-child to protect both. So I'd like you to pass this out without amendment if you could. In the Senate, there have been objections thinking it promotes trafficking. So thus the singular, although if someone does admit to multiple partners, certainly we would exercise judgment and treat both. But yeah, right now, many of us are doing this essentially illegally because we think it's the right thing to do. So I'll be here briefly for questions if you have any. Thank you.
Very good. Thank you. Will, Senator, questions very quickly. Representative Bueller.
Just real quick, and thank you, Senator and Doctor, for your testimony. It does not surprise me that we are the last 2 states in the union to do something smart like this. Thank you for your advocacy.
Thank you, Representative Bueller.
Representative Berquist.
Thank you, Mr. Chair. And yes, we have addressed this in the past, and we are slow. But some of the reasons we're slow probably is because there's some questions about it. We love health for all people, but is there any problem as a healthcare professional in concern for abused children who might have a relative or a case of incest or an in-law relative that is sexually abusing, or in the case of prostitution or any other kind of abusive relationship? To where the individual that wants it hidden can take the treatment to the person and still never have to deal with their issue of abuse.
So there are bad actors throughout the world, and it's hard to prevent them all, but we're mandatory reporters. So if we suspect trafficking or we suspect abuse, we're going to report that. If somebody comes in and needs 10 prescriptions, probably going to ask a few more questions.
Thank you very much. That's a good answer.
Committee, further questions?
Might I comment on the advocacy, Mr. Chairman?
Sure.
Patrick Allen, who's a family physician, I think he may have written testimony, came to me at the KMS luncheon and said, would you bring back this bill? So I have to live here. I go to receptions for other reasons than having to eat and drink a little bit. That really worked. That's why I brought this bill in, because somebody came up to me at a reception and said, we need to get this done. So thank you very much, Mr. Chairman.
Very good. Thank you for that. And he's going to testify here in a bit virtually. So thank you, Senator. Okay, next we have Ashley Goss. Ashley? No stranger to this committee either. Welcome.
Thank you. Thank you, Chairman Carpenter and the rest of the committee. I'm happy to be here. My name is Ashley Goss. I serve as the Deputy Secretary for the Division of Public Health at the Kansas Department of Health and Environment. Thank you so much for the opportunity to provide testimony on Senate Bill 448, which, as you heard earlier, would authorize the use of expedited partner therapy, or EPT. EPT is a clinical practice of treating the partners of patients diagnosed with sexually transmitted infections by allowing healthcare providers to prescribe or provide medication to the patient for their partner without first conducting a physical exam. In 2025, Kansas alone had 10,884 cases of chlamydia, If chlamydia is left untreated, it can lead to serious complications such as infertility, ectopic pregnancy, pelvic inflammatory disease, and in rare cases, life-threatening sepsis. In addition to that, Kansas had 2,430 cases of gonorrhea. In women, gonorrhea can spread to the uterus or fallopian tubes, cause pelvic inflammatory disease, which may damage the fallopian tubes, resulting in infertility, the risk of ectopic pregnancy, and in men, gonorrhea can have serious complications, which can also result in infertility if left untreated. Allowing EPT in Kansas would reduce barriers to care, including logistical and financial obstacles that prevent timely treatment. Ensuring proper treatment of exposed partners will reduce ongoing transmission of infection and help prevent reinfection of the original patient. Additionally, early treatment and prevention of reinfection will reduce the risk of transmission to newborns and help avert many of the long-term consequences, including infertility in both men and women. Preventative treatment has long been recommended for all partners who are sexually exposed to an infected individual within a specified time frame in order to prevent illness in the partner, limit further transmission, and avoid reinfection of the original patient. Compared with traditional standard partner referral, EPT has been shown to significantly increase the likelihood that partners receive treatment. The medications used to treat these infections are safe, inexpensive oral antibiotics with few side effects or contraindications. EPT has been widely used across the U.S. for many years, with no major adverse events reported, further demonstrating its safety and effectiveness. EPT is currently used in 48 other states, as you heard previously. Senate Bill 448 offers a practical and effective approach to protecting the health of Kansans by expanding access to safe and timely treatment. I urge you to support this bill and to ensure that Kansans have access to the best possible care.
Very good. Thank you, Ashley. Committee questions of Ashley. Representative Steens.
Thank you, and thank you for being here. Thank you, Mr. Chair. I just had a quick question. So would the KDHE then, how would they track the outcomes? Is that something that you'd be able to do?
We would. The treatment, these are reportable, and we do track them. What this will actually allow is for us to have a better idea of actually cases and treatment as we find them and they're treated.
Thank you.
Yep.
Representative Bryce.
Thank you, Mr. Chairman. Thank you for your testimony. I had just a quick question. I have to admit, I'll share a prison cell with Senator Clifford. I've also done this. But one of the things that I've always worried about whenever I surreptitiously did expedited therapy was I don't meet the patient I'm treating. I don't have their medical record. I don't know their allergies. So I'm glad to hear that there's not been any adverse events reported, but I'm always concerned that we don't need the the EpiPen or the Nepi for an allergic reaction. And it's encouraging, I guess, but you said there have been no adverse events nationally, as far as you know?
Yes, as far as you know, if any, very few, very minor. I think when they were reading the actual law, the bill, the regs in the bill, it does state, it talks about the pharmacy, and that's why we have that clause in there that does not hold them liable if there is some sort of contraindication. They can, just like a physician, they can only prescribe to the information you are given by the patient. So if the patient isn't forthcoming with allergies or anything else, then they assume that they can take this medication.
Okay,
Does that help you at all?
Yeah, that's very helpful. Thank you.
Committee, further questions? Thank you very much, Ashley.
Thank you.
Next, we have Patrick Allen. Is he there? Okay. Very good.
I'm here virtually. Can you hear me?
Yes, we can. Can you hear us?
Yes, thank you.
Very good. Welcome to committee.
Thank you for having me virtually. It helps me to not have to cancel quite as many patients. So yes, thank you, Mr. Chair, members of the committee. My name is Dr. Patrick Allen. I'm a family medicine physician. I've been practicing in Wichita for 15 years. I'm employed by Ascension Via Christi, and I have a faculty appointment at KU with the Family Medicine Residency Program. We train 18 family medicine physicians each year for a total of 3 years, and then send them out to care for all of your constituents. So as I reach out to these physicians across the state, everyone who I speak with, regardless of their political bent, supports this bill on expedited partner therapy. Many of these have reached out to you personally to voice that support. If not, I would invite you to reach out to them and get their thoughts on it. I think you'll find a supportive stance. As a primary care physician who trained other primary care physicians, I'm on the front lines of the health of our community in Wichita. I work in 3 different clinics, 2 hospitals. I provide prenatal care, I deliver babies, and I also do an STD clinic on Thursdays. So since I've been waiting for my turn to speak, I've gotten an email from the health department asking me to help them treat a case of ocular syphilis in the eye. So we are very much on the front lines here. Unfortunately, sexually transmitted infections are a common part of every family physician's practice. Personally, I've seen these infections result in hospitalizations, surgeries, chronic pain, infertility, other serious, unnecessary, costly complications. And pregnancy in particular, these infections can cause premature deliveries, low birth weight newborns, and infections in the newborns. These are outcomes which can have a lifelong negative health implications for children who cannot advocate for themselves. If you've ever had a family member have a preterm baby, you know the profound financial and emotional costs involved with a NICU stay. So these are avoidable things that we can treat. When we diagnose these sexually transmitted infections, every effort is made to treat not just the patient, but also their recent sexual partners. Ideally, partners make appointments and receive care on the same day, but in practice, the partner is usually not my patient. The partner may not have a physician. They may not have insurance. Usually the patient is a woman. Women come to the doctor more often, and the partner is a male. So I'll ask you if you've ever had a young male friend or family member that you've tried to get to go to the doctor. You're probably not very successful, and neither are we. So for various reasons, same day appointments often don't happen, and partners don't receive treatment, or they may receive treatment later. So if we treat the patient now and the partner gets treated in a month, it's not going to be effective if they're passing the infection on between each other. So this puts them, and if they're pregnant, their unborn children at substantial risk. In these situations, we can and should offer expedited partner therapy in order to protect the women that we see, the men who often we don't see, and if pregnant, their potentially affected children. Just this past month, my group cared for a pregnant woman who came to the hospital, was diagnosed with an STI. She was advised to take antibiotics along with her sexual partner, but this did not occur, and 1 week later, she returned to the hospital with a stillborn. Expedited partner therapy will not be a silver bullet. It will not solve all of these problems, but it is a tool that we physicians need in order to prevent these sorts of devastating outcomes. EPT works, it's safe. We have 48 case studies ahead of us to reassure against any unintended consequences. I'll also say that we are on the front lines of combating human trafficking and all forms of sexual abuse. I am confident that this bill will not promote any of those evil things. As a pro-life physician, please hear me. This bill, Senate Bill 448, is a pro-life bill. If you truly value both women and their unborn children, please understand that supporting this bill would be a consistent stance. So with that, I urge you to pass this bill, and I'm happy to answer any questions if you have them. Thank you.
Very good. Thank you, Doctor. Committee questions? Seeing none, thank you very much for being here. Okay, next we have Tara. Welcome to committee.
Thank you so much, Mr. Chairman and the committee. My name is Tara Chediar. I'm an OBGYN. I practice in Kansas City, and you all have my written testimony. It has all the good fancy language for supporting this incredibly needed bill. As has been alluded to, we've been trying to get this through for about 8 years now, and it has great support from basically the rest of the country. I am the Kansas section chair for the American College of Obstetricians and Gynecologists, so I tell you that ACOG is a huge proponent of this. We've gotten it passed in 48 other states. We'd love for Kansas to be 49. We've had great testimony from people who take care of babies, from people who provide primary care. I'd like to tell you, as a clinician who takes care of pregnant women primarily, this bill is essential. When I get these patients in to see me for prenatal care and they test positive for STDs, as Dr. Allen stole my joke, by the way, that was mine, alluded to, men don't go to get health care as much as women do, especially as young ages. They just don't. They don't have to. They don't need a pap smear every year. They don't need birth control. They don't get pregnant. So they don't see that as a need. The women show up. They have an STD. I try to treat them. They come back still positive. I try to treat them again. They come back still positive. Their partners aren't getting treated. It's costing money. It's costing time. And it absolutely can be devastating for pregnant women, because some of these STDs, as Dr. Allen told you, can lead to preterm labor. Some of them can lead to lifelong neurologic damage. These babies can get calcifications in their brains. They can be very, very ill. You can see deaths with severe STDs. If we can treat their partners, then they both take their treatment. They both hopefully take a little break from each other while that works, and then we can clear this quicker. It would save money. It would save lives. And it's very, very safe. I very much appreciate the question about, I'm completely with you, Representative Bryce. It feels yucky to treat people who aren't in front of me, but unlike Dr. Allen, I don't really actually have the option usually of seeing their partners, because as an OBGYN, that's usually not my space. So this is really something that would help us out a lot. Happy to stand for questions.
Very good. Thank you for that. Representative Droege.
Thank you, Mr. Chair. Thank you for your presentation. Is there any objection to this? I can't think of a reason not to.
I will tell you, and I think you've heard it, people been trying to be, I'll use this word, prophylactic about it. The argument we have gotten is the trafficking argument, right? That this is helping people who are trying to keep their STDs hidden. This is helping people that are causing harm. And I loved Senator Dr. Clifford's answer of, yeah, there are bad actors. I can't promise you that I don't have somebody that I'm going to send home with a prescription and really there's something shady going on. But I think that the potential benefit is going to outweigh that. And also, we are mandatory reporters. You do get a vibe. You do this job, and you do get the idea of, is this safe? Is this okay? So that's been the big pushback we've gotten over the last 8 years, has been concern about trafficking and prostitution.
Representative McDonald.
Thank you, Mr. Chair. I woke up this morning looking at this agenda, and I felt like it was Groundhog Day, because surely we already did this. So I went and looked, and it's unanimously passed out of the Senate. So I would really hope that we could rally our compatriots in the House to get this done. It's really important. Thank you.
Very good. Thank you for that. Committee, further questions? Seeing none, thank you very much. Do we have Randy Johnson here? Or is he virtual? No, it's Randy Johnson, Executive Director. Oh, it is Randy Bowman, but it's spelled, it's Johnson on here, but it is Randy Bowman, but I still don't see him.
Any other Randys?
Yeah. Well, yeah. So, all right. Well, I'm sure he's a proponent of this bill, but I don't know where he's at. So, and committee, I'll bring your attention to written proponent testimony from a number of folks. And I'll close the hearing on Senate Bill 448. And I'm going to open the hearing or begin working Senate Bill 430. Do I have a motion? Motion by Representative Bueller, second by Representative Reeves. Okay, do we need We don't need an overview, do we, committee? You remember this from yesterday? Okay. Discussion. Representative Bueller.
Thank you, Mr. Chair. I make a motion that we move, or we pass out Senate Bill 430 favorable for passage.
Hang on, there's discussion.
Okay.
Okay. Representative Ruse.
Thank you, Mr. Chair. I have an amendment.
Do I have a second? Second by Representative Orpezzo. While they're passing out your amendment, would you care to explain your amendment?
Basically, what it says is that because there is no third-party billing, that the cost for the testing be up front, and that the patient have an understanding of that before they proceed.
Committee, discussion on the amendment. Representative Steens.
Okay, so I reached out to Carly and I was trying to get an understanding of this because my understanding is that this confirming of the point of care, that this CLIA waived, that like there's already a waiver in place at these clinics. Am I reading that correctly?
Thank you, Mr. Chair. Jenna Moyer, Advisor Statutes Office. So the waiver is, it's the category of tests that can be performed under this waiver. And those kind of tests are things like your COVID test or a pregnancy test, ones that don't need the specific clinical laboratory conditions in order to be done correctly without and they're typically low risk of a false positive. So the waiver is separate from the consent to do the test, if that makes sense. It just gives you the category of the test that could be performed.
Okay, so can I ask one more quick question? So when I was speaking about the word may in there, I'm getting very confused with some of the language, I guess, because if it just says may and they're not doing it, do they really have to stop and get a patient to sign this? Like, they're going to just come into a clinic or wherever. What if you're out in a field somewhere and you're going to have to stop and give a patient a waiver to sign to do a blood prick test?
Thank you, Mr. Chair. So the may gives the physical therapist the scope of practice in order to do this without getting professional liability repercussions from the Board of Healing Arts. Because right now, in their scope of practice, they don't have authority to do this. And so the may just says you can, and you're not going to lose your license over it.
Right.
And then if this amendment were to pass, it would say you can't do it unless you get the written consent, which involves telling the patient how much it's going to cost and making sure that they're okay with that.
I don't know if I can support this because I feel like what I'm, at least unless I'm hearing it incorrectly, I mean, a patient, if they're there, they're probably going to have their own stuff anyway, and then I'm going to ask a patient to sign this? I mean, I'm just asking.
It would just depend on the physical therapist's practice. So you may have, you go check in, and then they could present you with the options. I mean, it would be dependent upon the practice.
Danica?
Yeah, my only thought is that this is what the physical therapist is performing the test. This wouldn't be a patient using their own blood glucose monitor to test themselves. It's if the physical therapist is going to test them with the physical therapist's tools. Does that make sense? That's the difference.
Yes, I guess I'm just, because to me, it's point of care, right? So they're testing at the point of care. So they're in treatment with the patient. And so at least this is the way I understand point of care. And so they're in the treatment with the patient, and then they're going to be like, oh, wait a minute, I can't test your blood sugar until you sign this waiver. I'm just asking.
Representative Ruiz.
It's not so much the consent, it's that the patient needs to know ahead of time what the cost of the test is going to be, because they can't bill.
Right, and it says in here that the bill would not allow PTs to bill third-party payers.
Right, but the patient should know how much it's going to cost. Is it going to cost $25 to prick my finger, or is it going to cost $30? And I mean,
No, I
I would
underst-
want to know ahead of time how much I'm going to get charged
Sure.
for it. That's all I was intending with the amendment.
Sure. I don't know, it just, yeah, I don't really understand it, only because it says the bill would not allow PTs to bill third-party payers. And I don't know, I feel like we're just getting into the weeds with some of this. That's all I'm saying. I really just, I don't support this amendment.
Representative Weichel and Droege.
Thank you, Mr. Chairman. So my understanding is not being able to bill third-party payers is not being able to bill your insurance for the test. But if I go into a physical therapist's office and they want to take my blood sugar for whatever reason, nothing prohibits them from charging me 15, 20, 25, whatever they decide. And so I think the point of this amendment, as I understand it, is just to make sure patients understand that if the physical therapist wants to perform that test, that there may be a cost that they have to pay directly in order to have that test done. Thank you.
Thank you. Representative Droege.
Thank you I just have a little bit different question. What about mentally incapacitated patients? You know, the dementia or Alzheimer's or something that they're being treated at home. If they're in a nursing facility or a hospital, they would have somebody to answer for them. But if physical therapist shows up, you know, twice a week at somebody's home, how are they going to know that they're cognizant enough to sign something like that?
I may, Mr. Chair. That's why we added the language, the patient or the patient's representative, which is the common language that we would use for someone who does not have capacity to make those decisions themselves. So that information would be given to the patient representative, and the patient representative could consent for that.
Representative Bueller.
Thank you, Mr. Chair. I do appreciate the spirit. I think the spirit of the amendment, but I think lining up with Representative Steens on this one, I think it's a little much. And again, I say that in relationship to the testimony we heard yesterday from the gentleman that ran the PACE, Blue Stem PACE in McPherson, in the conduct and the course of his practice. And as I understand, having been a recipient of physical therapy and others, I think this is unnecessary, even though I do appreciate the spirit of it. And I won't be supporting the amendment. Thank you, Mr. Chair.
Committee, further discussion on the amendment? Seeing none, Representative Ruiz, you may move your amendment.
I move.
You've heard the motion. All in favor, say aye. Aye. Opposed, same sign.
No.
The ayes have it. Amendment is approved. Back on the bill. Representative Turner.
Thank you. In conversation, thank you, Mr. Chair. In conversation yesterday, there was a question, and I know David forwarded out, of whether this was in other states or not. And I saw that information. Could we have that information? I know an email was forwarded, and I just didn't have time to really absorb it all. So could you give me the layman's nutshell, yes or no, it is in other states?
Sure. Leanne Thone, Legislative Research. Let me pull that back up. So this was an interesting thing to search for because different states kind of refer to these tests in different ways. What I found was that not all states refer to physical therapists, like call them out specifically as a practitioner who can do this, but they will say that CLIA waived tests are tests that someone who isn't necessarily a healthcare practitioner can perform because they are considered to be low error and easy to perform. So the 4 states that were listed in the Association for American Physical Therapy Association were Arizona, Kentucky, North Dakota, and Washington. I was able to find something that I think they would be able to perform these tests under for each state. In Arizona, they operate under the CLIA waiver, and they don't require labs to necessarily hold anything extra. And so if they hold this waiver, which is from the federal government, they would be able to do those tests in Arizona. In Kentucky, it's kind of the same situation. They do have a specific law for athletic trainers to perform capillary finger sticks. That's specifically called out in regulations. I was not able to find that specifically for physical therapists. In North Dakota, they define testing under their Physical Therapy Practice Act kind of generally as standard methods and techniques used to gather data about the patient. And then they also have a regulation that states an individual who is supervised by an individual licensed, like a physician or an APRN or someone like that, can do glucose tests and urinalysis. And then in Washington, they are also under the waiver, the CLIA waiver. So if you have that waiver, you can perform those tests. And then Tennessee was not mentioned specifically in their testimony, but they have a policy statement from the Board of Physical Therapy, which states that they take the position that physical therapists can perform finger stick techniques like glucometers and things like that. So that's what I was able to find. I didn't look a lot outside of that because I was looking specifically for those states that were called out in the APTA testimony. But I didn't also find anything super explicit that looked exactly like this law in any other state.
Very good. Thank you for that. Did that answer your question, Representative Turner?
Well, yeah, I mean, the testimony was that this was going to align Kansas with other states, and it doesn't seem to be the case. It sounds like 2 of those states required federal. There wasn't because of state statute. Another one had athletic trainers, which isn't what this topic is here. So I was just interested in that.
All right. Thank you for that. Representative Bryce. Oh, Representative Droege.
Thank you, Mr. Chairman. I don't think this is I'm kind of on the borderline on this. I have several thoughts that maybe you need to talk me out of. This is a finger stick only, and there's all these have OTC availability. I would think a physical therapist with forward thinking would be able to think this through and be able to do these things already with the patient's own glucosometer or purchase the lactate testing and then do it at their home. So is it necessary due to the patient will have that equipment, or you could have the patient? I do understand this bill would give insurance protection for a therapist, but I'm also concerned that by putting it in statute that it may open the physical therapist up for lawsuits if they don't comply, if somebody claims they didn't do what they should have done or misinterpreted or whatever it is, if you don't have a complete set of rules for how to do it. And then if you let somebody write up the set of rules, who's that going to be? The Board of Healing Arts? They could make an incredible set of rules that you could never adhere to. Let's see, I think that's most of my questions. And then if it passes, will it open for future expansion and go in a further direction to expand the scope of the physical therapist? But that's my thoughts on it, and you can convince me one way or the other.
Thank you for that. Representative Bryce.
Thank you, Mr. Chair. Coincidentally, I have an amendment that addresses some of that. So maybe I could shed some light. I guess it's going to be passed around? I'm sorry. I have an amendment, Mr. Chair.
Do I have a second? Yes. Second by Representative Rivas. Second by Representative Rivas. While it's being passed out, would you like to explain your amendment?
Yes, sir. Thank you. It has 2. Well, the first issue I don't think is controversial at all, but it's just more of a technical change. There's a spelling error with CLIA waived, and so that's taken care of in this amendment. The second addresses what Representative Droege was mentioning, particularly for the lactate testing part of this. There are not clear guidelines, and Representative Droege was mentioning that in order to protect physical therapists, there needs to be some sort of guidelines so they can follow that and have some protection from liability and so forth. As we heard, the conferee that was on WebEx yesterday, I think her name was Danielle, she mentioned that there are currently guidelines being developed from the National Physical Therapy Association. I don't know if that's the exact name of the association, but National Physical Therapy Association, and those could be implemented. However, I talked with Board of Healing Arts, Susan Guile, and it probably would be a year, maybe even a year plus before she's on the committee also that's looking at these guidelines and doing the field work for developing the guidelines. It'd probably be a delay of about a year before guidelines are available. So kind of a way to, that seems to be a way to do this with guidelines without delaying until the official guidelines would be to have rules and regulations by the Board of Healing Arts. Currently, there's no mechanism for the Board of Healing Arts to provide rules and regulations. The reason for the lactate particularly is it's not a yes or no test. It's, we talk about the pharmacists that might do a strep test, it's yes or no. We do a COVID test, it's yes or no. Flu test, yes or no. With what we're talking about with the lactate particularly, it's a moving target in different demographics of people over different times, comparing pre-exercise, post-exercise, how far apart do you do the testing, the delta between the levels, what does it indicate that you refer, or maybe you stop exercise, or maybe you do some other treatment. All these types of guidelines could be developed fairly quickly by the Board of Healing Arts as rules and regulations. Then when a year or so passes and the national organization has them available, the Board of Healing Arts could incorporate those if desired. So that might be a long explanation, but that's the gist of the amendment.
Thank you for that. So piggybacking on what Representative Droege just said, the Board of Healing Arts could actually write regulations that this was almost impossible to perform. So that's my biggest concern is what is going to, and they were opponents of this bill. So with them being opponents and writing the regulations to allow this bill, would they write it in such a way that they could not perform this?
Thank you, Mr. Chair. I don't think there's any antagonism intended. It's just that they were opposing because there were no rules and regulations and no mechanism in the bill. So this puts that mechanism in the bill. And as their oversight committee or oversight organization, it seems they would be the most appropriate. So thank you.
Dr. Droege.
Yeah, Mr. Chairman, I kind of agree with you on the healing arts and their rules they'd put up. Should we maybe table this and have them get together and write something so that the physical therapists are ready to come to the table and work? I know the healing arts is difficult to get along with, but should we do something like tabling this until they work it out more? Is that a possibility?
It's late in the session. Tabling, I think we're beyond that. It would basically kill it. The biennium ends in a few weeks, so it would be dead until last year if we did anything like that. So, Representative Blex.
Thank you, Mr. Leader. I guess I won't be able to support this amendment, just simple the reason that over the long history of my involvement with sometimes Board of Healing Arts and some of their policies, and I don't think physical therapists will have the representation on there. Frankly, I just don't trust them, so I won't be supporting it. Thank you.
Representative Buehler.
Thank you, Mr. Chair. And I'm going to echo a little bit what the previous speaker just said. And I'll go back to the last bill, Senate Bill 448. Expedited partner therapy took 8 years to pass that. We have heard numerous times this session where we'll do this, we'll kick the can down the road. Remind everybody that these are doctors of physical therapy. Doctors of physical therapy. Doctors of physical therapy. We are trying to put our arms around the practice of medicine in this state. We know we have problems in virtually every area, anesthesia, medical doctors, PAs, CRNAs, all of them. And until we're at least willing to open our eyes a little bit and admit that the one speaker said the science is outpacing our statutes. here would be yet another opportunity to allow the statute to remain in place for a year or so before we would come right back to this spot. So again, I appreciate the concern for patient safety, and I'm going to call it traditional medicine, but we're talking about doctors of physical therapy doing a glucose and lactate test. They are qualified to do this and interpret the test. I will not support the amendment. Thank you, Mr. Chair.
Very good. Thank you for that. Representative Droege again, and then.
I just had a question. Are they doctors, or I didn't know that physical therapists had to go to school that long.
My daughter has a doctorate in physical therapy.
Yeah. Yeah.
Representative Steens.
Thank you, Mr. Chair. Yes, I also don't support this amendment. I mean, here again, I'm just going to go back to what I looked up. CLI wave tests can be performed in physician offices, physical therapy clinics, depending on state law, pharmacies, urgent care centers, rural health clinics, nursing homes, community health settings. And as Representative Bueller pointed out, I mean, these are physical therapists who have 6 years of training. They often train in these clinics. I mean, I looked up the statutes here. It doesn't even have blood pressure and things. So I'm thinking to myself, this is point of care. This is so they can amend or grade their services. So when you're doing therapy with someone and you're like, oh, is this person's blood sugar low? Or is their blood pressure okay? You know, you're checking those things. I mean, that's something that a physical therapist does. That's clinical judgment that they use. To me, diabetic education is something that not just the nurses or the doctors do, their other clinicians also provide that education. So they're working in conjunction with the patient. Have you checked your blood sugar? Let's take a look at it. Oh, after 10 minutes of exercise, are there some issues with that? So they're grading that as they go along. So those are clinical judgments that they're making. And I just think we're getting way into the weeds with this. I mean, I hate to say this, but it's probably already being done many times, all the time in their practice. So I think that I agree. I mean, I even read what the Kansas Board of Healing Arts wrote down here, and they wrote down that the State Board of Healing Arts reports that while enactment of SB 430 could result in some actionable complaints, the enactment of the bill would likely be manageable within existing resources. So that is right here from the Kansas Board of Healing Arts. I pulled it right off. So I just think we're trying to really complicate this. Thank you.
Very good. Thank you for that. Committee, further discussion on Representative Rivas.
Yeah, thank you, Chair. So I would like to just weigh in a little bit on this. Since I've been on health the last 2 sessions, what's been frustrating for me is this constant challenges to scope of practice. And I think everybody means well, but quite often we are saying, well, just let them do it, just let them do it, you know, whatever. It's real simple. It's scientific. It's medicine. It's the way we're trained. You have guidelines, there's research, there's benchmarks, and you have consistency. And right now, there's no doubt in my mind these physical therapists are all able to do this just fine. But I will also guarantee you they will have many different opinions on how to measure and how to assess. If we get the guidelines in, now we have a benchmark, we have a standard, and we'll have a consistency, and they'll be held accountable in case other tests are going to be added. There's going to be more coming down the road. We all know that. This always gets bigger, it never gets smaller. So with the amendment, I am 100% for this bill. Without the amendment, I'm 100% no.
Good. Thank you for that. Committee, further discussion on the amendment. Representative Bryce, you may move your amendment.
Thank you, Mr. Chair. I move my amendment.
All in favor of the Bryce amendment, say aye. Aye. Opposed?
No.
Opposition, the amendment fails. Does anybody want their votes counted on that?
It doesn't matter, yeah.
Seeing none. Carly.
Thank you, Mr. Chair. With the leave from the committee when preparing the committee report, may I fix that misspelling of the CLIA wave test? It should be CLIA waved with an I instead of WAVED.
Committee, are you okay with that? Her fixing the technical amendment?
Yes.
Okay. Then, yes, you have our permission. All right, back on the bill. Seeing none, I would take a motion to pass out Senate Bill 430. Representative Bueller.
Thank you, Mr. Chair. I move that we pass out Senate Bill 430 favorably for passage.
Do you have a second? Representative Howell seconds it. All, as amended, that's right, as amended.
I thought,
Because it
it
did
had the waived word?
No.
Oh, yes, as amended. I'm sorry. Thank you.
As amended. All right. Everybody in favor, say aye.
Aye.
Opposed, same sign? No. The ayes have it. Bill's passed. Does anybody want their votes recorded? All right, very good. Committee, thank you very much for the work. Next week, we've got a few bills left over, and we'll finish working those. I think we do have a bill coming over from the Senate, the Kratom bill. I can't remember the number on it, but we will be working those next week. And so, very good. Thank you. Have a great weekend. We're adjourned.